Then, good morning. I want first to thank you very much for inviting me today. The topic of today is extremely important, and I think it's an excellent opportunity to highlight that the work of the European Union Drugs Agency is really combining different areas of work and different dimensions. And the topic of today is a perfect illustration. I would like just to mention or to refer to Paracelsus in 1538, who was mentioning what was one of the starting points for modern toxicology, that the difference between poison, drug, or drug for which you can have a dependence is the dose. And I think that's extremely important because in Europe today, we still have a lot of discussions at some local level, for instance, about the use of morphine for treating children that suffer huge pain from cancer, with a kind of old ideology pretending that if you give those children morphine, you will transform them into drug users, which of course is not true, and there is a lot of scientific evidence to sustain that. So our role as the European Drugs Agency is also to help make clear what is the science, what is the scientific evidence, and of course, by extension, we can, I will not enter into detail today, but certainly it's the same issue and the same challenge regarding medical use of cannabinoids, the use of psychedelics, and I think we are a bit lagging behind in Europe if we compared with some experiences that exist in Israel for a long time already for the use of MDMA, but also in the US. And I just have to apologize that as I have another meeting in Vienna tonight, I cannot stay to listen to all the fantastic presentations today. I would like to highlight also that today we are at a special moment in Europe, because if we want to characterize the drug situation, we would say that drugs are everywhere. We never had so many substances arriving in Europe, but also so many substances being produced in Europe. And this leads me to the second term, which is everything. Today, everything more than ever is or can be the object of addictive behavior. And finally, everyone, the direct consequence is everyone can have or know someone who has an acute or chronic problem of addiction. Of course, we need to include alcohol and tobacco in it. But also what has been increasingly the problem in Europe is drug-related violence. And this is why I think today, those days, we are at the EU is at a tipping point because there are more and more extreme right political groups pretending that they defend the security of citizens, like we are not all the same kind of citizens, which is completely against the values we share in the European Union. And on the opposite side, sometimes there may be the impression that those who work or defend the right for people to use drugs or harm reduction interventions, they are just in opposition with the others. I think the debate, the dichotomy is completely wrong, and it's important that we take a strong stance against it. I think we have an increasing problem in mental health in Europe. It was already the case before the COVID pandemic. The COVID pandemic has hugely increased that because of the lockdown, because of what I would call, even if a bit exaggerated, the lost generation, because all the youngsters who were ready to start a new young adult life going to the university, they've been locked down for 3-4 years. I was reading yesterday in The Guardian that, for instance, there is a serious problem in universities because people don't go anymore to universities because of teleworking, because of lack of interest, because of the fact that the cost of life has increased and they need to find a job to pay for their studies. Nothing new, except that it's becoming more acute, which means an impact on mental health and the need to find a response. And then, what I will not have time to detail today, but I still need to mention is we have plenty of new drugs, new substances, and new uses of substances. And we are not ready to address that, including in mental health, including in the hospitals. I give you one illustration. We are talking for 4 or 5 years now about hemp sprayed with synthetic cannabinoids that is disseminated everywhere in Europe. I'm lucky enough, I have an agricultor selling me organic vegetables. And one day last year, he tells me his son is in the emergency ward, completely delusional state for 2 weeks. Well, for me, it was clear that it could be, of course, always we speak about juvenile psychosis, but not everything is juvenile psychosis, thanks God. But nobody knew about synthetic cannabinoids. And it's not only in that hospital. And the challenge is we have knowledge. In Lisbon or with national drug observatories, the knowledge is not reaching the clinicians. So we don't give the knowledge, we don't reach the level where we can help save lives or help tailor different interventions. So that's one of the challenges for the new European Union Drugs Agency. Of course, the war in Ukraine, and also I want to celebrate the participation of our Ukrainian colleagues and friends. I want also to say that Ukraine will participate in the launch of the new European Drug Union Agency in Lisbon early in July. The war in Ukraine has also a disruptive effect on the EU member states and on the perception of citizens about safety, about future, a huge uncertainty. And finally, what I think it's time to do, and I want to congratulate the Czech Republic and our colleagues and friends for taking these initiatives. I think we need to innovate, we need to reinvent drug policies, but including for the use of psychedelics, or the use of cannabinoids, the use of ketamine, or whatever. Because when we speak about science, the difference is the dose. It should not be the ideology. And we need to innovate. Why? Because most of the model, the mental reference we have, or implicit theory, is about the heroin epidemic. But as I briefly explained, we have so many drugs, so many substances, that it doesn't match. So we need to reinvent. If we want to reinvent, we need to develop increasingly more inclusive policies. Of course, what is new in Europe, and we cannot escape, and we should not avoid, when we try to make a local diagnosis, there is no way to make an assessment of the risk if we don't include violence. And let's be clear. For instance, in some countries, there is a huge debate about drug consumption rooms. Let's be clear. Drug consumption rooms, they are not the cause for violence, but drug consumption rooms are not the solution for violence. So we need more comprehensive, more holistic approaches. We need to address vulnerabilities, and I'm really worried to see that because of the pressure of violence, but not only, we hear a bit everywhere in Europe more discourse about war on drugs, war to people who are using drugs, punishing and cutting the social benefits to families. I think we need to be clear. Any measure that increases the vulnerability of groups and families can only have the adverse effect. So we should restrain and we should propose other alternatives. And finally, we need to reinvest our communities. Prevention was mentioned just before. There is a lot of evidence-based experience about prevention in the community, but also we need also to reinvent community policing that has been cancelled in many countries. We need to join forces. And finally, and I think the meeting today is a huge contribution to that. Again, I'm really frustrated I cannot stay and listen to all the presentations, is that we need more than ever a human development approach. And I think the topic of today and the role of all the professionals in mental health should be better recognized. And we cannot forget that for the moment, because of the successive cuts in the national budget for the last 20 years in Europe, if there was, for instance, a new COVID epidemic tomorrow, some of the intensive care unit service would remain closed because nobody wants to work anymore there. We have cut the budget, the working conditions for the professionals, including in mental health. In many countries, they are more difficult than ever, and we have more needs. So instead of having just a cost-benefit approach saying, well, if you have not enough V3 therapeutic session, then you are not covered by the health system. We need to provide more support. It's about our society. And every single problem is just a symptom, I think, and I believe, of a more general problem. So together and with all the fantastic experiences that will be shared today, I think Czech Republic, and I think it's a huge change if I compare with 10 years ago, or one of my previous visits in this room was for topics that were much more controversial. I really want to congratulate the Czech colleagues and professionals, because you are showing the way. There is no magic solution. There are a lot of things we need to debate, but you show that we can have a good debate, open debate that is evidence-based. Thank you very much.